Hi, I'm Dr. Tiffany, and I want to talk to you today about carpal tunnel. Frequently, when you go in and you have carpal tunnel surgery, what they do is they create more space right in here for the tendons that are going in. And by clipping that tunnel, it gives space to those tendons so you don't feel the irritation into your hand. But the question I always have is, why are those tendons inflamed, and why, when there's always been enough room at that tunnel, why don't you have enough room now? And so as I look a little deeper in my office at what's going on. Frequently I find a condition which is actually a lot worse than carpal tunnel, especially if you leave it untreated. And so I want to warn you, if you're one of the people that you experience this, make sure you follow it up to make sure that you don't have something going on at your neck. And let me explain why this connection is. This right here, this is your spine. And so these are the bones. You've got discs in here, and the yellow coming out from here are the nerves. So in your lower neck, the nerves down here, they actually go into your shoulder, arm, wrist, and hand. And when you have a misalignment up in your neck, that actually irritates the nerve that's going down into the muscles down here that's going to affect the tendon and actually affect your hand. So you need to correct it up here. And that could also solve the symptoms down here to where the surgery might not even be necessary. But the thing I want to warn you about is if there's a misalignment here and it's left untreated, that's a progression that will not only affect here, it will affect all sorts of areas in your upper extremities, and it will progress if you don't get it checked. So please, if you think it was just carpal tunnel, check with a chiropractor. You need a chiropractor who does x-rays and does motion studies. They'll be able to tell you if the issue is actually coming from up here. If you happen to live in Hillsborough, I have those studies in my office, and there's actually a couple other people around me that also have that. We'd love to help you find the right doc, but please don't just stop with clipping a tunnel and making more room without knowing why. All right, have a great afternoon.